Welcome to Three Questions With. I'm Hugo, publisher of the Latino News Network and your host. Three Questions With is a public affairs program elevating the voices and visibility of matters most important to the Hispanic-Latino community by speaking with subject matter experts and community leaders on the social determinants of health and democracy. Latinos are the largest and fastest growing group in the United States, yet their presence in healthcare, particularly as physicians, remains disproportionately low. Nationwide, Latinos are 19% of the U.S. population. Still, just 7% of all physicians and surgeons are Hispanic, according to the Pew Research Center. What's worse, Latinas make up just 2% of physician population, according to researchers at UCLA. The underrepresentation of Latinos in the physician workforce has significant implications for healthcare equity. Latino patients often face barriers in accessing culturally competent care, language barriers, and a lack of trust. Dr. Emma Olivera has focused much of her work on helping the medically underserved community by taking on various leadership roles, including as a pediatrician in the suburbs of Chicago. It is here where she aspires to advocate for children and continue to mentor the next generation of leaders in medicine. Dr. Olivera is our guest today. Welcome to the program.
Thank you so much. I'm happy to be here.
So you're a general pediatrician with Advocate Health and Downers Grove. Let's start the conversation there. Tell us about the work that you do, some of the challenges and opportunities.
Well, I'm a pediatrician, and so I take care of children, and I'm very fortunate to be a Latina and speak Spanish. My parents really told me that it was very important to learn Spanish. And so one thing that I learned, very young, volunteering in a hospital, is that this was really important for patient care. I've seen mothers come into the office and say, this is the first time that I've actually spoken to a doctor in my language after having a 13-year-old. They're like, oh, I'm not using a device. And that's really shocking to me. And so, navigating the healthcare system sometimes is really challenging for families. And so they'll drive 50, minutes, an hour, just to talk to me so that they understand how to best take care of their children. And so we know that, with the pandemic, how the Latinos are really having healthcare disparities and really affected by different diseases. I can navigate and really, teach them how to take care of their health.
Spanish is the second most popular language other than English spoken at home. Why do you see that there's so few Latinos, pediatricians or in the medical field, and many of them that don't speak Spanish?
Well, I think that one is that, what we know from history is that sometimes they're told that they shouldn't speak Spanish, that they should assimilate to the U.S. culture, and that speaking Spanish is bad because that this is the only country that speaking two languages is somehow looked down upon. And in other countries, if you're multilingual, that's a great thing. And so they try to tell people not to speak two languages, but I think that that's a great thing. So the education system really affects that. And representation really matters. We see that when we're in, watching TV and things like that. So I think that really plays a part in it.
Yeah, absolutely. And I think some of that is born from just being the experience of being a first-generation immigrant and experience some of the prejudice of not knowing the language, not knowing the culture, and now you're having children and you don't want them to suffer through that. And so you almost push them to shed their Latinidad. But of course, in this day and age with so many Spanish-speaking people in the United States, hablar el español no es un lujo, es una necesidad, que sea en medicina o en cualquier otra carrera que uno tiene. One of the things that we talked about before the show started that really was, we quickly talked about it, but it's the humanitarian work that you do. Your parents you're of Bolivian Cuban descent, but you're about to take a trip to Bolivia in January, one that you've made many times. Tell us a little bit about that.
Well, I'm going to do a mission trip with Healing the Children Northeast, and that's to Bolivia, taking care of children who have cleft lip and palate. I'm really passionate about that. Actually, to learn medical Spanish is different from conversational Spanish. So in medical school and residency, to learn that not conversational Spanish, I went to do trips to Bolivia during that time period. And so to refresh that medical Spanish, I take these mission trips. And it's really rewarding because taking care of children is obviously a passion of mine. And seeing the underserved population in Bolivia is so so different from the United States, right? Here, we can get care for these children immediately. And in Bolivia, they drive 8, hours in a motorcycle with their baby, to see if their child can get surgery. It's astounding to me.
Yeah, and it sometimes, no system is perfect, but an example like that, 8 hours in a motorcycle to get health versus some of the challenges that we have here, we really need to count our blessings. Now, I want to go back to the importance of having more Latinos in medicine that you mentioned. So let's moving on to our second topic. You wrote a chapter on the Latino Medical Student Association about how community service, advocacy, research, and mentorship have been the long-standing principal threads that have propelled the Midwest region forward in helping the disparities in medicine. Tell us about the importance of mentorship and being a mentor in achieving educational success.
Well, actually, I wanted to be a pediatrician since I was about 4 years old. My pediatrician, Dr. Enrique Lujan, was Bolivian, believe it or not, and he used to call me colega. So he was my first mentor, and so I received that passion through him. And when I was volunteering, like I said, I used to see that, in the hospital, moms would be seeing their child get CPR and not know why their child is getting CPR because they didn't know the language. And so through these various things, I realized that I really wanted to be a doctor, but no one in my family really could tell me how to navigate college applications and do this. So at school, there's the Hispanic Center of Excellence at UIC and the Latino Medical Student Association. So the medical students at my school actually told me how to apply, how to interview, and I found mentors in students to navigate the system.
And that's so important, seeing someone that is reflective of your lived experiences, whether it's background, gender, et cetera, is really important. And as a child of perhaps, well, I'm speaking for myself, as a child of immigrant parents, I'm doing everything for the first time. And it's really difficult for them to help me because, unfortunately, one of the reasons why they came to the United States is because they didn't have the same resources, especially for higher education. So mentoring is so key. It's certainly been a key in my career as well. Can you share a little bit more about what are the specifics? Now, you mentioned a couple of examples in your experience in mentoring and with your colleagues. Are there particular areas that you yourself and others help students with that you've seen over the years?
Well, I think one is a lot of people think that, achieving higher education is expensive. And that's true, but there's ways to get around that, like applying for scholarships. We all hear about imposter syndrome. And one thing that really limits us is applying for something like a scholarship. But that leads to so many scholarships going to the wayside because no one applies to them. And so then those scholarships don't get any students who apply and go empty-handed. So I always say that no basket gets, the slam dunk without anyone shooting for it. So I always shoot for that basket because you never know. So that's one thing that I always tell students to do is shoot for those goals because a lot of times you will get those scholarships and that money is out there. So just apply for all the scholarships that are there. That's key because I've actually gotten a lot of scholarships after I put that imposter syndrome aside. And so I got, scholarships that paid for my first year of medical school. I wouldn't have done that if I had people telling me that I wasn't worthy. And so a lot of times mentors are the ones who gives us that, push to apply for scholarships.
That's such a really great advice and really great analogy. If you don't shoot, you're not going to score. And a lot of times it's about volume to get on the scoreboard. Now, let's talk a little bit more about the chapter that you wrote. Tell me a little bit more about the focus of the chapter that you wrote within that book.
Well, it's really to document the history of LMSA, the Latino Medical Student Association, because one thing is that these stories don't get told, right? And so we wanted to make sure that we're publishing the story or the history of our association, because if it's not written, then no one really knows our history. And a lot of times with anything in Latinos, these stories get told by word of mouth, by the abuelas, by the bisabuelas. And so then it's kind of like you heard this from this person. And so we really wanted to make sure that while these people are around, we want to make sure we write it in a book.
Yeah, and if you don't document it, over time it gets watered down and you kind of lose the authenticity and the immediacy of the original story. You have a website, and we've also talked about you're looking to produce a podcast as well. Tell us about the focus of the information of your website and this future podcast, because it's one part the patient, but it's also one part your colleagues. Tell us a little bit about that.
So Latino in Pediatrics is really about inspiring, the next generation of pediatricians, Latinos in pediatrics or in primary care, and also focusing on the health of how Latinos are affected by, different areas of health. We know that Latinos are affected more by diabetes, for example. And my actual godson has type 1 diabetes. So talking about that, how families can navigate that, because, and it would be great. I know Latino, endocrinologist. Talking about that on a podcast would be great. And aspiring the next pediatric endocrinologist. I would love that.
Yeah, it's so important. And I'm great, and I'm looking forward to talking more about how I can help you and Illinois Latino News can help you in realizing that. The last thing I wanted to talk about in regards to mentorship is, and you said it, right? The first part is just getting on the scoreboard, applying to get to medical school. But sometimes part of the problem is retention, right? So you got to medical school, but then because of a lot of different factors, you drop out or you get disillusioned. So retention is a problem. Tell us about how mentoring helps increase retention of these potential future doctors.
I think one is we've all been in those shoes. So we can kind of say, okay, you may not have done well on this test. Now this is how we need to pivot on your study strategies. Everyone has a different way of studying. And so I think in medical school, the first thing we learn is what is our best way of studying. And really, a lot of times test taking anxiety is really our killer. We are smart. Latinos are smart as just like everybody else. And really it's the test that is our greatest enemy. So figuring out what about the test is really keeping us down. That's really what keeps us out of the, graduating, out of the, arena of medicine.
Yeah. And I think understanding it's not a sprint. It's a marathon.
It is.
You need to kind of develop thick skin along the way, but absolutely valuable advice. You're watching 3 Questions with Dr. Emma Olivera with Advocate Health and Downers Grove. When we come back, this native Chicagoan is going to share some more of those lived experiences and how it inspires the work that she does today.
I'm Kimberly Loftus, and I am financially secure. I have made it my business to help you achieve the same financial transformation for 2024. Let me help you on your path to financial freedom. Budgeting is not a one-size-fits-all process.
What can I cut? Because there are a lot of things that we think that it's a necessity that's not really a necessity.
In the Money airs on Thursdays at 7 p.m. on CAN-TV 19, CANTV.org, and on the all-new CAN-TV Plus app. Experience the power of community television.
We've been talking to Dr. Emma Olivera about increasing the number of Latino physicians and how mentoring plays such an important role in raising those numbers. Now we're going to talk a little bit more about you and your upbringing. You're a native Chicagoan. You graduated from UIC and completed medical school at UIC College of Medicine, Rockford campus. You mentioned already about a pediatrician inspiring you to pursue a path of medicine and specifically working with children. Tell us a little bit more about that.
Well, as I mentioned, I really wanted to be a pediatrician. I really didn't know how to navigate that. My parents told me that once I wanted to be a pediatrician, that I couldn't get off that path, and that someone was going to tell me, I wasn't going to be a doctor, but that I needed to stay on this goal. When I was at UIC, my counselor told me, even though my grades were average, don't see a pre-med advisor, because that person was going to say, it was going to happen. So that's exactly what I mentioned. I had to see LMSA, the Hispanic Center of Excellence, get into this mentorship program and find people who are my tribe. My parents always told me, for example, dime con quién andas, te diré quién eres. And really, I didn't, when your parents tell you stuff, you're like, whatever, I don't really believe that. But I really tell that to my mentees as well, because you really need to find a tribe. People who always uplift you will always keep you through that path. If you're hanging out with people who are like, oh, you're not smart, you're never going to make it, medical school is hard, go into something else, be a nurse, which nurses are amazing and I can't do my job without them. But if they tell you to do something else, or I've had friends go, oh, what's going to be your plan B if you don't go to medicine? I never had a plan B. I didn't get into medical school right away. I always had that as my plan A. So I really think that if that's your passion, always keep it as your plan A and never go for a plan B. So I would say that that's key.
Yeah, y tienes que tener garra, which is absolutely what your parents instilled on you. And we talked that your father's Bolivian, your mother is Cuban. Both came to the United States right away, specifically to Chicago. And education was such an important part of your upbringing, that foundation to reach success. And how many people have been told, unfortunately, you can't do this, you can't do that, whether it's because of your socioeconomic background, your ethnicity, your race. So what a wonderful example of really, and it's really difficult, especially for a young person, of swimming, against the tide of just such negativity. And then the last thing I would say to your point, yes, right? Surround yourself with people who are going to lift you up, beginning with yourself. We cannot be, we have to be our biggest cheerleader and not kind of buy into some of that negativity, because if we don't lift ourselves up, how are we going to, inspire others to do the same? You were able to get a proclamation in the city of Chicago and Rockford for National Latino Physician Day. Tell us why that was so important for you.
Well, October 1st, as of last year, was the first time we did National Latino Physician Day. And the reason why we wanted to create this day, a few physician friends of mine really wanted to found this day, was because we wanted to inspire, young people to, one, become physicians, and two, create awareness that only 6 to 7% of the physician workforce is Latino. Only 2% of the physician workforce are Latina. And yet 20% of the U.S. population is Latino. We need more, necesitamos más, because we're seeing that this really affects healthcare. We need culturally competent care. When I see patients, I'm seeing them not just speaking Spanish, we talked about language, but also that cultural competence, that cultural awareness. When I see them, I understand that when they're giving remedios, I understand that that they're going to tell me about those remedios and they're not going to feel embarrassed about talking about them. And that when, I'm seeing a baby in the office and the sibling says, "Doctora, my tummy hurts," I look at the mom and is like, "Oh, is it really hurting?" She's like, "No." I'm like, "Oh, sana colita de rana," and it's fine. That is what that counts as cultural competency, right? Cultural awareness. Only I can do that to that patient, right?
We all know sana patita de rana is an all cure. Another all cure is mentolato, right? And if you don't know what mentolato is, it's like Vicks, right? That cures everything. But part of our culture is also some of these home remedies from our abuelitas and our mothers. Now, you mentioned about cultural competence. A lot of times, and especially now because of access to technology, we're self-diagnosing. What advice do you give to parents about self-diagnosing and some of these home remedies that, we believe they're all cure, but well, maybe they are. But maybe mentolato is. We'll talk about that. But what advice do you give them?
Well, one is I think that there is so much that Google MD can do, right? Even, I think there's, it's good to do a little bit of research, but still come into the office and tell me what your diagnosis is, right? Don't be afraid to share that with me. And then I can tell you, okay, XYZ, I think you're right. XYZ, I think you're wrong. Sure, you can try some of these remedios or some of these things, or actually study shows that this might be bad for you. Sometimes these things are okay. Honey, actually for a cough above age 1 is actually a great thing. Do that when you have a cough. Other things can be harmful, but definitely share them because I'm not gonna, papa them because I come from a culture that tries these things.
And it's really important to have that safe space and acceptance as opposed to this door slamming in your face. What are you doing? No.
Right.
Which sometimes happens because of, again, the lack of cultural competence. Dr. Olivera, you've been so generous with your time. Thank you very much for being our guest.
My pleasure.
When we come back, la última palabra, the last word on the urgent need of more Latinos in the physician workforce.
This week on Change Agents, we will meet some leaders who are working tirelessly to address homelessness in Chicago and who will shed some insights on the Bring Chicago Home initiative, which voters will see on their March primary ballots. Join me Thursday at 7:30 p.m. on CAN-TV 19, stream us live on cantv.org, or watch us on the CAN-TV Plus app. Experience the power of community television.
And now, la última palabra, the last word on more Latinos in the physician workforce. With demographics changing in the United States, it has become increasingly important for physicians to be able to speak languages other than English. Spanish is the language most frequently spoken at home other than English in the U.S., with an estimated 40 million people who use Spanish as their first language. Research published in the National Library of Medicine shows that patients without language, concordant healthcare providers are more likely to experience miscommunication and adverse events, are less likely to comply with medications and medical advice, and are less likely to come to follow-up appointments. Latino doctors can also provide culturally sensitive care and a better understanding of the unique needs of their patients, improving outcomes for the community. The lack of Latino representation in the physician workforce is partly due to various barriers faced by aspiring Latino doctors. These include limited access to quality education, financial constraints, and a lack of mentors and role models in the field. The problem is especially severe among women, as highlighted by the UCLA analysis, which revealed that only 2% of all physicians in the United States were Latina. Over the years, the medical field has faced difficulties in retaining female physicians. According to the 19th, 40% of women physicians either leave their professions or switch to part-time work within 6 years after completing their residency. Contributing factors include inadequate childcare and paid leave, unequal pay, as well as higher instances of discrimination and harassment. Addressing this issue requires targeted efforts from schools, medical institutions, policymakers, and communities. Scholarships, mentorship programs, and pipeline initiatives can help support and encourage more Latinos to pursue careers in medicine. By promoting diversity in the physician workforce, we can foster a healthcare system that is more inclusive, responsive, and equitable for all. It's time to recognize the urgent need for more Latino physicians and take concrete steps towards building a more inclusive healthcare landscape. And that does it for this edition of 3 Questions With, a collaboration by Illinois Latino News and CAN TV. LNN is dedicated to best serving Hispanic Latinos with local multimedia news and information websites across the U.S., including Illinois Latino News, a statewide community-focused initiative. I invite you to look us up on our websites and chat with us via social media. Tell us what you think about topics we talked about today, and please send me suggestions about what you think we should talk about in the future. Because at the Latino News Network, you are more than just our audience, you are our contributors. I'm Hugo. Thank you all for watching.